Okay, so let's kick off this meeting. So a warm welcome to everyone to this EIT Health Partner meeting to explore new opportunities in 2024. So my name is Monica Åberg Yngve and I work as the Public Affairs Lead and the Deputy Managing Director at EIT Health Scandinavia. So a warm welcome from my side, and with that said, I will leave the word to our collaboration lead, Matilda Wennerholm.
Yes, thank you and welcome again, and thank you for taking the time during lunch. That's much appreciated. I don't see you, but I will be sharing my screen. And today we have a full agenda. We are happy to explore different kind of projects and opportunities and present those to you. So we're going through a quite full agenda, as said, from European Partnership for Personalized Medicine, and then we will enter the flagship call. We will go through the biobank new platform, also some public affairs topics, and the Work in Health Foundation. Then we will hear about open innovation and TEF, and then we will enter the skills arena. Pact for Skills, this AI Skill Sync, and also the Deep Tech Talent Initiative. And then we will round off with some information about the innovators community in the end. So for this agenda, we also have a lot of speakers, naturally. So myself and also a few colleagues from the Scandinavian hub is here, and then we are joined by some central office staff as well, but also from other CLCs from Spain and France and Benne and so forth. And then we have some cross-kick colleagues from manufacturing and raw material as well. We are happy to get your questions, but please put them in the chat and we will be making sure to answer them accordingly. And let's get started, even though people might be joining in the meantime. There will be the first topic by Marika around EP ProMed.
Okay, I hope you can hear me well. No echo? Okay. So welcome also from my side. I'm glad to introduce you EP ProMed project. This is a European Commission funded initiative to join personalized medicine community. Please go to the next slide. It is 10 years long project, and it started very recently on 1st of November, and EIT Health is invited partner to this partnership. Next slide, please. Aim of this project is to pool together national and regional fundings in order to get the bigger pool for projects and to also get more tangible outcome, bigger international outcomes of the projects. European Commission is coordinating these goals, but the money is coming from national and regional funding agencies. Altogether, we have 50 different partners, mostly ministers, national funding agencies, and EIT Health and BBMRI joined as well in this funding period recently. The full please go back. The full budget of this initiative is 335 million, and out of that, 275 million is going for grants. So it is pretty big pot what we are sharing to partners. Thank you. Let's go to the next slide. Here you can see the structure of our activities. Here I would like to point out that Work Package 2 is focusing on research on personalized medicine. Work Package 3 is on innovation, and Work Package 4 on implementation. And beside that, we have horizontal work packages 1 and 5. Next slide, please. In this slide, you can see how EIT Health is contributing to this project. We have a lot of goals in the plan. We are also organizing several matchmaking events and roundtables. Our task is to engage medical societies, and we are also contributing to the content of innovation goals. Next slide. And on this slide, you can see as upcoming goals in timeline. I don't want to spend much time on it, so you can look later to this table. But here you can see that EIT Health has a pretty big task. Next goal, please. And in the first year, we have only one call opened, and this is focusing on research. And we have a 45 million pot, what we will share in this year. We expected to have 25 up to 30 different projects. The call is opened right now. Short proposal deadline is 5th of March. And here below you can find also direct links to call document, guidelines for applicants and pre-proposal form. And as the money is coming from national agencies, as a first step, I really recommend you to contact at first your national agency. You can find the contact data from the call document annex. And also what I wanted to point out, the projects can be up to 3 years long, and 100% funding rate is here. Consortium should be at least 3 partners from 3 different countries. And you can find more information about this call from website, but we had also information day. You can find the recording of this from the website, and there is also partnering tool where you can find partners to your consortium and where you can see also what consortiums are looking for new partners. Next slide, please. And this is event calendar, so you can see also what is coming during this next 7 years. Next slide, please. Okay, yes, and this is all from my side. I hope it was not more than 5 minutes.
No problem. Thank you so much, Marika. Then we go to the flagship call. So that will be me presenting that very quickly. So we are addressing also in this flagship this year 2 main areas which we want to focus and address the most urgent needs that Europe is facing at the moment. So the first one is in new models to deliver healthcare. And there we are focusing on how we can redefine the healthcare models to be able to implement robust analysis of databases in place, so secondary use of data, as well as establish a foundation for high-value care, value-based healthcare going forward. The second area is in digital transformation of healthcare. Here we are focusing on how we can support and adopt the transformation of digital health to access not only digital health medical devices, but also implement secondary use of data according to the European health data space. So for new models to deliver healthcare, we are looking for new healthcare services projects and consortiums with innovative healthcare services, combining providers and also payers, reimbursers, involving industry and SMEs, solutions that have reached the commercialization stage. We are aiming for generating these projects to generate evidence, coming to the fact that the convincing payers to reimburse those new models that are also based on PROMs and PREMs and adopt their reimbursement models accordingly. So we want to basically make sure that these innovation projects actually provide the sufficient evidence for adopting those new healthcare service models during the time frame. For the digital transformation of healthcare, we are addressing 2 topics in one, so the digital medical devices, but also the health data. Here we are looking for technology development projects. They could be hard and software, led by SMEs or the industry, with corresponding IML levels of 5-6, reaching the 7-8 by the end of the project finalization. With this flagship, we want to support both from innovation but also education, that we adopt how digital health is used and implemented to make sure that it's accessible but also how we are using the existing data already. So the projects that we will be looking for is actually going to focus on validation or certification, but also very much around market access of those digital medical devices to facilitate a quicker uptake on the market. The overview, as you can see here, so we have education activities in green, fellowship and I-Days, but we also have some labeled education models and the master degree program. The deadline is very, very soon, so countdown already started. It's end of February, so the majority of the activities is actually in a couple of weeks' time, and then there is a small call, also a shorter call in Digi Innovation, opening in June. So now we will hear from Monica about the new platform for biobank and health data.
Good morning, everyone. Good morning, and welcome to our event today. Yes, I will present to you our current project on biobanking. Next slide, please, Matilda. Thank you so much. So biobanks and registries are about clinical samples and data. And biobanking comes with a lot of value for medical, for the healthcare system and mankind, but also with a lot of obstacles, unfortunately, because of the current system. So there are a lot of small biobanks and registries, but they are not interconnected. There isn't an efficient way to browse for samples, and there is no communication amongst different countries, national legislations in order to access samples. And the users, potential users of biobanks are also very different, and they have different backgrounds. Can be industry, can be academia, can be patients. So therefore, it's a very fragmented landscape. And what we thought that is an untapped a need in the system is to try to harmonize the existing biobanks and also to train prospective potential users on how to access biobank data and samples. Next slide, please. So a few years back at EIT Health, we launched a few initial events. Starting in 2018 with a think tank, and then in 2019 matchmaking and digital sandbox, and then in 2022 we incorporated it in the European Health Data Sweden project. What we have achieved today in terms of our biobank project is, next slide please. It's a two-component innovation project. So we created a website, which is an interactive database and inventory of virtually all existing European biobanks and registries that is searchable for users. They can search for country where the biobank is, or the type of data, type of disease, and access the point of contact person who is responsible for the biobank. And they can also learn about the country-specific legislation that regulates the access to that biobank. And in collaboration with Health Data Sweden and also BBMR-ERIC, we developed the second part, which is a course which will be launched soon. and it is a training course. Thank you. This is the training course. It's gonna be uploaded on the EIT Health Academy. And next slide, please. And this is the website, which will be, it will be launched, it will be publicly available, exactly here. And in the next slide, exactly, these will be the modules of our EIT Health Academy course. So there will be an introduction on biobanking, ethical use and access of biobanks, the BBMRI ERIC audit program, how they certify and accreditate biobanks, quality requirements, and then more about how BBMRI accreditation and utilization of biobanks work. So this project will bring, and also there will be a couple of interactive sections about biobanks in the expert centers and a very detailed national overview of the legislation in the countries where BBMRI ERIC is present. So this course will provide a lot of training for users, biobank users and patients, and also it will bring a lot of value and visibility of EIT Health, and also in general to EHDS. So that's it. And also it will be we will be launching a marketing campaign, and we will be hosting it into our EIT Health new innovation projects and what we do page.
Thank you. Thank you. So switching topics.
Thank you so much.
To public affairs, policy making.
Thank you, Matilda. So I would like to take this opportunity to present briefly to you how we work with public affairs and stakeholder engagement. So ongoing work with the policy and political stakeholder engagement, we focus in relation to our flagship topics. And within this, our most important tool is the think tank, our thought leadership forum, through which we contribute to healthcare policy debate in Europe. Also work within the public affairs team. We work to leverage opportunities to strengthen our work through identifying EU synergies, looking into new funding instruments, and also new initiatives that could be of interest. So next. And the EIT Health think tank, so the think tank has actively supported the evolution of EU legislative frameworks, and we ran between 2021 and 23 4 roundtable series. And from these, we have been sharing our analysis and recommendations with policy decision makers to guide different legislative actions. So next. And as you all are aware of, we at EIT Health put a lot of work into the think tank for 2023 when we focused on implementing the European health data space. And we ran a number of roundtables across Europe, and we had one in Stockholm taking place in June last year. And the next think tank for 2024-25, the topic and focus for this one is under discussion and will be launched and discussed later this spring. But we will also continue to work on the EHDS, the next step. We have a pan-European report coming up where we gather all the recommendations and findings from the different roundtables to be summarized in a report that will be launched and discussed during our EIT Health Summit in Rotterdam in April. EIT Health will also be following in the development of the EHDS proposal and also the work with the implementation across Europe. And we're also looking into identifying new ways to engage with stakeholders to support the implementation process. So next. We have today a lot interesting presentation with us on EP Pyramid and also TEF and Pact for Skills. So I will not go into these funding opportunities, but I would like to mention that we do have this MOU, the Memorandum of Understanding with the Innovative Health Initiative, IHI, which is a public-private partnership between the European Union and Europe's life science industries. And within this initiative, there are now 2 open calls, IHI calls, one with a deadline 16th of April and the other one on the 22nd of May. And I will not present these calls, but I would like to give you this information, and please go in and check the calls. And if you have any questions around that, we could support and help you with. So please contact us. But I think that we'll also find good information on the IHI website. But we are happy to discuss this also further. So I think that was all from my side, Matilda. Thank you.
Thank you, Monica. So we will switch topic now from public affairs policy to skills gap and the skills crunch. And we would like to continue now with a few topics. The first one is presented from Work in Health Foundation and the Future Health Heroes campaign. There has been a change in presenter, so I think instead of Urska, we will have Claire to present that.
Hello.
Hello. The stage is yours.
Thank you. Thanks, Matilda. Yes, Urska sends apologies, but she's not well today, so she's focusing on her health. And so I'm presenting Work in Health, and I'll present later the Pact for Skills as well. So you see double of Claire today. Can you move to the next slide, please, Matilda? So the Work in Health ecosystem and foundation, and I think Urska has done quite a lot of slides, so I'll let you read them when you have time as well, when you go back to your offices. But the main point is to address the talent and the skills gap in the health industry. And so we have done some research, and we have done some discussions with the different companies, medtech, pharma, startups, and so on. And the key point of this slide is to showcase how much the question of skills and how much the question of attracting the right talent is crucial for the health industry, and also how much it might be underestimated, both in terms of money investment inside the companies to upskill and to reskill their own workforce, but also underestimated potentially at policy level, which is why we had many discussions with the Commission that led to the creation of the Pact for Skills. If you can move to the next one, Matilda, please. So the purpose of the Work in Health Foundation is summarized in this one sentence. We close the gap between the health industry needs and the fit-for-purpose talents to foster health innovation for all. And how we do it, if you move to the next one. Thank you, Matilda. How we do it, so we work across 4 different chapters. I don't want to use the word pillars because I think in EIT Health it's too connotated. But the first one is around anticipation of the skills needs. So a lot of panels, a lot of discussions. We're having a couple of publications that are planned this year to provide information and data and intelligence to the entire ecosystem on what the current skills needs are, but also trying to look a bit in the future for the future ones. The second stream of action is around attracting new talent, because in our interactions and activities for the past year, we have experienced that there is a challenge with attractiveness of the health industry. And that the industry is also competing with other kind of ecosystem for the same talent. For example, the digital talents, they are chased by all kinds of companies and all kinds of ecosystems. So there's an element of putting together resources and having a discourse at not at the company level, but at the sector level. This is the health industry. This is the benefit it has for patients. This is the benefits it has for the ecosystem and for the countries that we are trying to facilitate. The third one is about training, which is something we have not yet started to implement a lot at the Work in Health Foundation, but based on all the intelligence that we have, how do we complement what EIT Health can fund in terms of training programs, and also how do we promote some of the programs that may exist in the EIT Health ecosystem. So in some of your companies or universities, how do we promote them to a wider audience to increase the uptake of the skills? And the fourth one is about matching. And here we have started to organize career fairs across the past years. It's an online event where, as a talent, as a company, you can meet, you can find an internship, you can find a job. There are also discussions on research partnerships, or how industry can sponsor PhD thesis or develop new partnership in research. So if you move to the next one, maybe, Matilda, because I'm aware I only have 5 minutes to raise your interest.
Mhm.
So what's coming up in the next months is one of those skills intelligence publication that I mentioned. So this one is done in collaboration with the European investment funds that EIT Health is working with the Venture Center of Excellence program. And so it will focus on the skills gap within the investors team, so the venture capitals and the investment funds, and also the skills gaps in the startups, as in early startups, but also more mature startups and scale-ups, and where there will be potentially opportunity for you in the Scandinavian ecosystem to contribute. So we're looking for startups to do interviews with, to have their feedback on the challenges in recruitment, the challenges in skills, and how it impacts their business. And we will organize 4 roundtables between, I think it will start March and until mid-April. And I think Scandinavia will be one of the spots where we organize a roundtable, so with investors, with startups, with other kind of clusters, actors who will also facilitate those discussions. And all of that will be compiled into a nice publication that will be launched at Bits and Pretzel events that EIT Health is a partner of. That's at the beginning of June in Germany. And yes, thank you, Matilda. And also a couple of more dates to remember. So this career fairs that we have organized, the next one will be in May 24th. So we will soon start the communication campaign, and we're looking for both talents. So that could be your students, that could be your alumni, that could be people in your teams. We're also looking for companies or organizations that are recruiting. So it could be companies as in industry or startups, but it could also be universities, it could also be other kind of actors if you have specific jobs to place. And we will put a special focus on this career fair in facilitating internship for students. So that's also something we can expand the dialogue on, how in your universities, in the masters and the PhD, especially the ones that are labeled under the EIT ecosystem, how can we facilitate the placement of your students in internships? And the Future Health Zero is a campaign that ties together a bit of if you can move to, I think this one is fine, Matilda, thanks. That ties several activities that EIT Health had to boost women entrepreneurship. So that's the Women Entrepreneurship Bootcamp. There was a specific prize for a female-led startup. There's a summer school, top female founder summer school, and so on. So bits and pieces around the EIT Health ecosystem to support women entrepreneurship and women leadership. And so the idea of having this campaign, futurehealthhero.eu, was to tie those pieces together and also to start acting in this attractivity issue. And so to ask younger talent, people who are currently in masters or in PhDs, to tell their story and to have inspirational role models. And so we will be launching, I think, in the next week. So you will hear also more from Urška and your communication person. And I think that might be it, Matilda. If you move to the next one, I think I covered I know Urška had a lot of slides.
Yeah.
So I think you can take them home and have a look and stay in touch with Urška. Some of you know me and know that I was associated with Work in Health, but your main contact for this is Urška, and I will be your main contact for the Pact for Skills, which comes later.
Definitely. Thank you so much. And I can also facilitate the connection. Thank you, Claire. And you will come back in a moment. Thank you very much. Now we are switching to the newly launched, or last year we launched the Open Innovation Program. So Maria is taking the floor.
Okay, thank you very much, Matilda, for the invitation, and everyone for to this meeting. So the Open Innovation Challenge is a challenge-driven program. So in the Open Innovation Program, it was based off on a study that we conduct for several months, talking with all the stakeholders in EIT Health, and we discover that there is a need for support our corporate and business partners, and also healthcare system and healthcare providers in order to promote a demand-driven innovation. So really bringing together this stakeholders' perspective into understanding what is a clinical and business unmet need, so and how we can align that, putting always the patient in the center. We want to facilitate the innovation adoption and or even future procurement that could improve patient outcomes or reduce healthcare costs, or even work towards a new models of healthcare delivery. So this is an accelerator program where corporate business partners and healthcare system, healthcare providers, together with EIT Health, we will promote this acceleration to fast track the implementation of solutions in real setting, and also that we will support them into shaping their value proposition and business model. So in our next slide, what you can expect from this Open Innovation Program is to work collaboratively together with EIT Health and another partner, and that we will innovate, or that you will find innovation, or you could innovate beyond your organization and build relationship and alliances around the ecosystem. Also, you will be part within the program in the codifying of the challenge based on these real unmet needs, and really to find a solution that is fit for the purpose. And then EIT Health, we will support in different parts, but also we will bring market analysis, what are new technologies around, the maturity of the market, what is the legislation, and we will help you to discover solutions across Europe. So we will have a wide scouting capacity. So how that works is around a 6-7 months program that will start with a call for promoters. So the call is always open, is on a rolling basis, so you can always present an offer. But we are going to do 1 or 2 cutoffs per year. Last year we did our first cutoff, and I will explain you what is going on now. But the program first is 1 month of the program setup, where we get an agreement with the promoters, and we define the timeline, and we set up all the program. And then we will start working in different workshops and interviews in order to codify or understand where is the real unmet need and where we want to focus the challenge. After that, we will open a call for startups to participate, and we will do dissemination, recruitment, evaluation of the proposals, consensus meeting all together. And finally, we will do an acceleration program and modules that will end up in a pitch. So EIT Health will finance this program, but we are looking for strategic alliances where together we can move to a next phase of piloting these solutions in real setting. So if you are interested, you should look for a tandem between a healthcare system and healthcare providers in the same region or country. So we will operate locally. Then you can apply for in EIT Health Smart Simple, and here you have the link. You need to create an account, and you have to apply together, these 2 entities, with the same core partners. And we will ask you why, the unmet need, the problem you want to solve, the TRL or IML, the impact, and your involvement and commitment. And then we will select you as participant of the program based on the clear unmet need and the problem, the impact that the problem has, and also the commitment. So your contribution, so what we expect to collaborate in is in the evaluation of the calls, in the lecturing, and also in the mentoring and in the pitch event. So you are part of pretty much all the program. The format is mainly online, but the final event will be in presential. And we will have to sign and agree with this promoters agreement that allow us to operate. And at the moment, we have opened 2 challenges last year. One is with Takeda and Leuven Hospital in inflammatory bowel disease, that the call for promoters is already closed, and we are about to kick off the program with the 8 selected startups. And now we are about to launch in a couple of days the call for startups together with Tronico and University Hospital of Nantes in sexual transmitted infections, so a spread control of sexual transmitted infections. And the call will be open for 2 months. And heads up, soon we will do this cutoff, and we are happy to support you in looking for a tandem or to become a promoter. Thank you.
Thank you so much, Maria, for that. Now we go to testing and experimenting facilities in health and healthcare, AI and robotics, and Bart is going to present that.
Thank you, Matilda. So TEF stands for Testing Experimenting Facilities for Health AI. Next slide. And what we want to do here is to validate AI in a real life environment, so with healthcare providers. And we're not alone. There's more TEFs. There's also TEFs in cities, manufacturing, agri-food. And also within the healthcare domain, there is also TEF-like infrastructures coming up in ICU and on genomics next year. Next slide. So it's basically a platform. So we bring together producers on the left-hand side of AI solutions with providers of facilities. And what you see in the middle is we don't just validate their AI solutions, we also facilitate the market access. So there's also certified bodies, for instance, on board. And there's also a strong education component. Next slide. So you see that reflected in the consortium. There's 51 partners. These are labs from hospitals, but also notified bodies. The EIT Health is also there as a connector. The project runs for 5 years, 60 million, where roughly half of the money goes to make the demand side, to make the offer side ready, so the physical and the virtual labs, and the other half goes to the SMEs, but basically as a deduction in the fees they would pay to use the facilities. There are some calls, but I will talk about that later. Next slide. If you look at the map, so you see some blank spots, but with RISE and Karolinska, the Scandinavian involvement is quite strong in TEF. Together with the MDs of EIT Health, we're also exploring now how we can connect the gray spots in Denmark, Estonia to the TEF Health platform. Next slide. If you're interested in the budget, you see that most of the budget really goes to the physical and the virtual centers. Next slide. And the call. So the call is a call for startups that can come from all over Europe and that can apply. And this is just a pilot. It's just in Portugal that can apply to make use of validation labs in Portugal. The next call that will come up in 3 months from now is not hopefully in 3 months, it's not a pilot anymore, but it's really cross-European, meaning that, and that's the next slide then, that it's not just Scandinavian startups that can apply, but also all the services that are provided are also including those that are provided by Scandinavian partners. So that's the 2 sides where I think Scandinavian partners could join. But of course, apart from being active in these calls, the idea is also to really act as a network and to build novel collaborations. And for this next slide, we have the community, the TEF Health community, which is a part of the innovators community. I will not go into detail on this because there is a presentation on this later today. And last slide, then, if you are interested in who is behind this, it's next slide. It's a team. I thought I had included the slide on the team, but it's a team of 5 people, and they sit really across central office and the different hubs. And of course, you can always reach out to me or to one person of the team to know more, but also to Scandinavian partners. RISE and Karolinska are really very, very active in this initiative.
Thank you so much, Bart. We will also share the slides afterwards so we can connect you if needed. So thanks a lot for that. Exciting times ahead indeed. Now we will switch to the next opportunity that we are presenting today, going back to the partnership for skills and the pact for skills in the health industry. So Claire is coming back shortly.
Hey, I'm here. Thank you, Matilda. Me again. So I'm here to talk to you about the Pact for Skills for the health industry, for which we do need to find a shorter name to encapsulate what it does. So the Pact for Skills, think of it as an alliance, a long-term partnership that the European Commission has asked EIT Health to coordinate. And the intention is to make sure that the training offers, whether that's university, whether that's vocational training, whether that's also training already in the university, matches the demand in terms of skills need from the industry. So there's a present element, sitting down with the industry to assess how much the training offer on the market already matches their needs and what needs are, but also a whole lot of strategizing and planning for the future to make sure that the industry, the health industry in Europe has the right workforce that it needs with the right skills to be competitive and sovereign, because there's a political tie, there's a political element after the COVID crisis and the learnings. And so this Pact for Skills also comes with an open line of communication, let's say, with the European Commission and different kind of policy makers, officials, to make sure that the health industry implements the green transition and the digital transition, but also that this group that we are gathering can act as a soundboard, an informal forum to discuss some of the topics and new policies. And so the Pact for Skills encompasses all of the verticals of the health industry. So that's the pharmaceutical industry, that's the medical devices industry, that's the Commission wanted a special focus on the PPE, so the personal protection equipment, and that's also the digital health industries, even that's a bit of sometimes a fuzzy category. And we'll be looking across the next years, because again, this is a long-term partnership. We're just we're setting up the group, and we'll be welcoming more members as we go along in the years. But we'll be looking at the different categories of skills that we have already started to map with the initial members of the pact. So digital, green skills, everything around new technological advancement, focus on regulatory affairs and compliance, because that's been a big pain point from the industry. There are also elements on manufacturing and cleaning the processes for biomanufacturing, for example, and an aspect of diversity, equity, and inclusion, which comes back to my earlier speech on working else, attracting a more diverse pool of talents to the sector. If you move to the next one, thank you, Matilda. So one of the first steps that we are doing is, so we're kicking off this Pact for Skills, where you have seen some of the logos of the organizations that have joined. And it's a nice balance of industry, either associations, but also companies, universities and training providers. And there are sometimes regions or clusters or other associations that represent the needs of companies and SMEs. And one of the first steps that we're focusing on is applying for funding. So EIT Health is coordinating a proposal under the Erasmus Plus Blueprint call, which is the typical funding that covers the initial phases for the Pact for Skills. And we are developing a work package structured around what you can see here. And we're assembling the consortium. We're in the final step of finalizing the consortium and the team. And so what we'll do in this proposal is a whole lot of mapping, so developing the skills intelligence, both the present needs, like I said, but also the future needs, and assessing the education and the training capacity that we have in the ecosystem to meet that needs. developing a skill strategy out of that meets the needs and the expectation of all of the verticals that I mentioned. And here a specific focus is also on the needs of the SMEs, because we should not forget that 80% of the workforce in Europe, and that's not just for the health, but 80% of the workforce in Europe is employed by SMEs. So we need to integrate them in this strategy. Then there's an element of already implementing some kind of trainings to address urgent needs, and also to think about designing and deploying new trainings for emerging needs that will be more that will be done in later years of the blueprints. And there's an element of certification of the training, as well as developing a sustainability and commercialization strategy with the industry partners. And I know I've been in discussion with some of you, and some of you may have seen a version of those slides in different partner webinars that we had. And I was in Lisbon as well last week, where I presented some of that. So like I said, we're in the final steps of finalizing this consortium. What we are still missing is industry representation. So we are still looking for a couple of industry members, especially from the medtech, medical devices ecosystem, to play an active role in this partnership to make sure that their needs are represented, and also one more vocational training providers as in the sense of an institution that provides on the job hands-on kind of skills. And we are drafting the proposal as we speak, because the deadline is approaching fast. That's the 7th of March, so in 3 weeks. And maybe to conclude and wrap up, so the Pact for Skills, and that's what I try to represent in this image. Think of the Pact for Skills as the long-term thing that is here to stay. So we're building the tracks for that with the group and the Pact for Skills. The blueprints that we are finalizing is only the first step to acquire funding, to develop skills program, to have a better idea of the skills need to adapt your trainings, and to maybe reflect on the university strategy. There will be other kind of opportunities that EIT Health will facilitate, and also that the Pact for Skills group will facilitate. Specifically, I think in a couple of years, ESF and ERDF funding to boost the upskilling and the reskilling efforts. And we also trying to set up in the governance of the Pact advisory committee or advisory bodies on different kind of topics. It could be green skills, it could be diversity, it could be digital transition. So I think in the coming months as well, there will be opportunities to provide your expertise in those bodies, and also participate in the workshops and the consultations that we will organize to be at the discussion table. And I think that's it for me, Matilda.
Yeah, thank you so much, Claire. Indeed, to be continued. Now we will go to the cross-kick EIT, AI community, and the Skill Sync and the AI challenge, presented by Maggie and later on Adrian.
Thanks a lot, Matilda. A great pleasure being here. Thanks for the opportunity to explain what we're doing in this nice cross-kick community where EIT Health is participating. I'm here, as you mentioned, together with Adrian, my colleague from manufacturing, also working in the project. We are in this cross-kick initiative. We are EIT Health, but also digital, manufacturing, food, climate, and urban mobility. And the idea is to promote the adoption of artificial intelligence at the different organizations and startups. We are providing support, and also improve and boost the AI solutions made in Europe. Next slide, please. When we were collecting and aggregating all the companies supported by the different kicks working in AI, also academic institutions providing training in AI, and when we put all the ecosystem in one place, we've been greatly surprised that we can say that we are the largest ecosystem in artificial intelligence in Europe. And then we started thinking about, well, okay, we have this nice ecosystem, and how we can contribute. And one of the elements was we have a very nice and an amazing set of data. Next slide, please. And one of the outcomes, one of the results I'm going to present, is a tool that is fully aligned with the objective of the Pact of Skills for upskilling in artificial intelligence. Now the tool is ready. It's been validated in a number of partners during this year. Every KIC proposed a few partners. You all are also invited to join us and to participate in the pilot this year. And the tool is for different type of organizations, for startups that want to improve the skills that are needed for innovation. I'm going to show you, if I have a couple of minutes, a live demo in a while. It's also, and you'll see that, it's also useful for academic institutions to improve the portfolio of the training and to see, okay, in this region, there's the opportunity to provide this specific training, and you don't have this in your portfolio, so it's an opportunity for that as well. And also for policymakers to improve the innovation indexes in different regions. With this, we already generated some nice reports analyzing the skills that are needed to boost innovation in different countries for different profiles. As mentioned, the tool now is for artificial intelligence, which is the scope of this cross-KIC. It's been already extended in the SME for Digital Decade project in cybersecurity blockchain, and we're extending this to all deep tech areas. And now we're also extending the tool to provide upskilling recommendations in the health sector. This is going to be presented soon at the EIT Health Summit. So you all are invited to join the session where SkillSync will be presented in more detail. May I have the possibility to show?
Thank you so much. Maggie, being mindful about time, and apologies, but do you think we could save the sharing of the tool? I can share it later with the audience because I'm being mindful about the time, also to keep people's lunch hour. Is that okay? So I can share later. Sorry for that, but I think we thank you very much. I think we could also hear from Adrian now from the manufacturing KIC about the AI solution, the cross-KIC AI solution challenge. So if we can continue with that.
Okay, yes, we can. I will also be mindful, so I will keep it short in the end. It's hi, nice to meet you, and thanks also to be here. I'm from EIT Manufacturing, but like I said, this is a community project, and we are really trying to work together here. And we really see that startups and also industry has problem to implement solutions or to find the starting point to use artificial intelligence in their companies. So what we promote is like the AI challenge. So we can come to us, we will get you, I think you can go to the next slide. What we do is like we're trying to find some solutions with you together. So that if you have a problem, if you want to start with AI, we can source our ecosystem. We have over 500 startups in our database already that are proven useful startups that are active in AI, that can scale up pretty quickly. So this is actually a chance for you to really work with us. We will start actually in March, and it will not be like a dedicated call for it, but it is more like a service. So whenever you have the need and you need to look for startups, we will be there for you to help you. We will have a workshop with you to even maybe make some ideations on which AI technology to use and which direction can it go. And in the end, also, there will be a small award placed on it, and you can maybe together with a startup make a pitch and win the award for a POC implementation that we can then, let's say, help a little bit with a small budget. But in the end, it is more a service that we are creating right now for everybody that is interested. And this is a little bit the outline for this year. Of course, there are a lot more topics like hackathons and something that we think about, that we want to plan, that we want to implement here to really push forward AI solutions. But I think just being mindful also for my time and just saving a little bit. If you have any questions, come to me, come to Maggi, go to our website. You will find all information there. Also in regard of policy in the AI Act, we have a tool promoted there. If you need some help with this, you can also go there. But with that, I would like to close and give back the floor to the others. Yeah.
Thank you so much. Thank you. Indeed, a lot of things happening around AI for sure, which is closely related also to the next topic and the deep tech. So thank you. We will now move to also another cross-kick initiative, the Deep Tech Talent Initiative. And Francesca from Raw Material is going to present that.
Yes, so thank you, Matilda. Nice to meet you, everyone. I'm Francesca, and I'm the Outreach and Stakeholder Manager of this other cross-kick initiative, which is the Deep Tech Talent Initiative. The objective of the initiative is to skill, upskill, and reskill 1 million talents in the field of deep tech in Europe by the end of 2025. We have a very broad approach to deep tech. So by deep tech, we mean any technology that is highly disruptive, highly cutting edge, and that can change our daily lives. So we really cover basically any sector. The idea to work on this initiative comes from the new European Innovation Agenda, which has highlighted several drawbacks in Europe in the field of deep tech. And the European Commission suggested to work on education in deep tech to boost Europe and make it more competitive. Next slide. The Deep Tech Talent Initiative is open to any type of actor somehow working in deep tech. So among our partners, we have education and training institutions, enterprises, associations of enterprises, financing partners, institutional partners, because the idea is to create the biggest European knowledge hub in the field of deep tech, where different actors can work together, can collaborate, and reach the 1 million objective. Next one. So this is the situation now. It's much better than this, actually, because when I shared this slide with you, Matilda, we had 111 partners, while today we have 122. So it's even better. And as you can see from the logos, these are not 100 logos. I couldn't fit all of them, but you can find all the partners on our website. In any case, as you can see from the logos, we have very different actors on board, including Intel, Abodu, JA Europe, Talent Garden, MinaLearn, University of Graz, of Lisbon, of Barcelona, several accelerators, training institutions, so a very diverse network. Next. To reach our 1 million objective, we are putting in place several tools and initiatives. You have them here. The first one is the Deep Tech Training Platform, which already contains 94 programs in the field of deep tech. It's public. I will leave the link here in the chat. You can have a look. Then we have the Deep Tech Skills and Learner Matching Platform, which is a matchmaking platform to connect talents with the best available deep tech courses. The Deep Tech Learner Results Database, which is our alumni community for the talents, and the Deep Tech Radar, which is where you can find market and trends in the field of deep tech. And the nice thing of the radar is that it is populated with use cases coming from our partners. So it's a way to give visibility to the innovations and products and services of our partners. And then we have funding opportunities, communication and dissemination activities. In May, we will publish a call for proposal that will follow Horizon Europe guidelines, and whose aim is to fund the development of new deep tech programs. Next. So what is the benefit of joining? This is, I think, the last slide, or almost. The benefit of joining is that you would be part of the biggest European knowledge hub in the field of deep tech, which means having access to networking opportunities, visibility, attracting the best talents or partners from all over Europe, developing collaborative projects with all the partners, and then in general, the prestige coming from joining the initiative. Next. Okay, so if you want to know more, just reach out to me. Just one last thing is that joining the initiative is free. There is no fee to pay. You just need to sign the pledge, which is not a contract. It's a high-level document where you commit yourself to organize activities in the field of deep tech until the end of 2025. Thank you.
Thank you so much. We have reached far in the agenda, so we have the last opportunity to be presented related to the innovators community by EIT Health and by Miriam. So take the floor, please, Miriam, to present your community.
Thanks very much, Matilda. I'll be very quick. The Innovators community is the place where innovators, partners, startups meet beyond the end of a funding period. So, of course, once you get in, once you actually sign an agreement with EIT Health, you, of course, get into a program, but what happens after? And also during that time, with regards to your networking opportunities with other partners, with other innovators, this is the place where you can sign up for it. So this is for EIT Health Partners entirely free, and I'll be sharing the link in the chat, and there'll also be a QR code on the last slide. Next slide, please. The way we are run is that we have one volunteer regional coordinator per region. You see them all here. There's, of course, one also for Scandinavia. The reason we have this setup is that we want to have an ear on the ground. So we want to listen to the innovators. You know that the business plan writing from EIT Health is very much top down for 3 years. In 3 years, a lot of things can happen. And with this person that lives in this case in Sweden, we make sure that we listen to what's happening in the community throughout the business plan year. We ask, of course, this representative a lot of questions with regards to what are your people saying, what is needed in terms of innovation in health at the moment. There are a lot of surveys that are run. There is a close collaboration, of course, with the regional CLC and exchange. Why it makes sense. So the CLC, of course, equally wants to be in touch with the community, wants to know what's going on. And at the same time, the CLC also has the need to market the programs they're running together with you, the partners. And in this case, Adnan here that you see in the center right, he is able to reach out the community and say, you are actually the right target group for this test program, for example, and the call is ending in 2 weeks, so feel free to apply. So it's a bit of a mutual benefit between the regional EIT Health office, of course, us, a central office, and the community on the ground. Next slide, please. These are our offers specifically for partners. I'll just touch upon 3 here. You can find expert and mentors. In general, use the platform for your own needs. You can launch any call you like. If you want to run a survey, you run a survey. If you want to limit it to the Scandinavia group, you do so. If you run it through the whole European group, you may do so as well. There's a job board, so you can hire high quality talents if you like. You can post your job offers as EIT Health Partners for free. And ask us for further collaborations. Now, this is a bit of a special field that Bart mentioned before. You may have your sub-community hosted by us for free as well, where you can either gather all of your co-managers for one of your EIT Health activities. For example, let's say, yes, you've been granted a certain amount to run a program that you've applied for. Now you need to manage yourselves in the group. So you would have a management group on our platform to exchange documents, to have a direct chat function. So in general, to manage your activity. The other option, if you have a program with participants, you may invite all of your participants to this group to have a direct exchange with the participants. So this is something where we would just need your email, say, yes, we're interested in setting this up. Please help us. We will only get involved as much as needed. You have full administration rights of this group. We are just there to help you. Next slide, please. This is just a screenshot of the job board. So lots of opportunities you can post there. Next slide, please. Examples of events and programs and how you can actually advertise them on our platform. What we also do for our members, this may actually be also relevant for you as partners, we negotiate deals. So we are 4,000 members now. Of course, with 4,000 members, there is a bigger opportunity to get a special discounts for events such as Slush, /Helsinki. So we're currently in negotiations together with them and also on a CrossKick level, because on a CrossKick alumni level, we're 15,000 members. And of course, Slush is more willing to give us a special deal for 15,000 members if we negotiate this together. So such deals are also exclusively available for members of our community. Is that already? That's the code. You find the link in the chat. Thank you very much.
Thank you so much, Miriam. And actually, we are about to conclude. We have gone through all the topics, the projects, activities, opportunities for you today, which we were very happy to do. So I would like to say thank you to all the speakers, but I would also like to address what's the next steps to you, our partners, and what is the intention here. So we will share a survey with you shortly, which is actually linked to the agenda, where we would like to indicate that you indicate your main interest. Where do you want to collaborate next, and what is most interested to you going forward? So if you could provide your input in that survey, and then we would be able also to map you a little bit to who else in the ecosystem and who else among the partners would you like to collaborate with. And then based on this input, we can then also formalize some clusters, which we have been mentioning when we have met with you the last couple of months. And for those clusters, based on your input, where you would like to specifically deep dive, you could also then include the stakeholders, the ecosystem affiliated partners as well. So that is a little bit what is coming next from our side. So with that being said, we have reached the Q&A. I don't see the chat, so I don't know if there is anything there, but I would quickly also like to mention that we have the summit coming up in April in Rotterdam in April this year. So that's a very good opportunity as well. As you heard some of the speakers also mentioning that the next phase of their projects and so forth will be presented and available also there. So that's just a heads up for the upcoming summit in April. I don't know if there are any questions. Maybe some of my colleagues could express that in that case. Otherwise, I would like to take the opportunity to thank you very much for taking the time to join. We are so happy to see you and looking forward to see you next time. Is there anything in the chat or anyone who would like to ask anything? Otherwise, we say thank you for today.
I think that all questions have been responded to in the chat, and we will go through the chat in detail after this and see if we have missed anything.
Exactly. So what is happening now, we will share the survey, a very quick survey, so you can indicate your specific interest. We will also share the slides so you can go back and go through them. And we will also share the recording if there are colleagues of yours that could not attend. So you will get all of that shortly.
Thank you, Matilda. Thank you, everyone. Very informative, and you know where to find us should you have any questions after this session. Just get back to us. So wish you also a nice Friday and weekend ahead, and we look forward to hearing from you in the near future and to collaborate with whatever you could be finding of interest. Thank you.
Thank you. Have a great weekend. Bye-bye.
Bye.
Thank you. Bye.
Thank you. Thank you.